The history of present illness can be organized into the mnemonic old carts. It is important to note that there are a few variations of the old carts mnemonic, in which the letters stand for different things. For example, S can stand for severity or for symptoms. The variation used here will stay consistent throughout the lessons. You'll want to determine onset, location, duration, and character of the pain, as well as alleviating factors, whether it radiates, temporal patterns, and other associated symptoms. We'll go through each of these in a bit more detail. Let's look at onset first. You want to determine exactly when the pain started. Be very specific with the patient here. Did it start today? If so, when? This morning? This afternoon? Did it start 1 week ago? Or did it start 2 days ago? Next, determine the location of the pain. Again, be very specific here. It is important to localize the pain the best you can during the subjective portion, which will set you up for success during the physical exam portion. Ask about specific regions, such as the right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant, epigastrium, and suprapubic region. I even like to ask the patient, now, with one single finger, point to the area where the pain hurts the most and look to see where that is. It will often surprise you because that forces the patient to really think about it, and it may not be what they said initially. Next, determine how long the patient has had the pain. Again, be specific here. How many hours, days, weeks, months have you had the pain? The onset of pain is important to help determine if it has an acute nature or chronic nature. Pain always has a character to it. You just have to ask and be specific with the patient. The type of pain is the character of the pain. For example, sharp, stabbing, dull, cramping, achy, or shooting are all ways to characterize pain. You'll need to ask if certain things alleviate or worsen the pain. This might include different positions, such as sitting, standing up, laying down, moving, or not moving. Ask about certain foods, if they are fatty, greasy, spicy, acidic, caffeinated, milk-containing, or wine or alcohol. Also ask about medications, such as nonsteroidal anti-inflammatory drugs. Does the pain radiate to other locations of the body, such as the back, neck, shoulders, or arms? Does the pain have a specific pattern of recurrence? Does it appear every morning or night? Is it happening every fatty meal, or right after consuming dairy products, drinking a cup of coffee, or eating spicy or acidic foods? Lastly, you'll want to ask about any other symptoms associated with it. This is the S portion of old carts. We will discuss it more in detail in the next lesson. To name a few, ask whether these symptoms occur before, after, or during the pain. Ask if there's any associated nausea, vomiting, or diarrhea. Remember, the pain could be from several different organ systems: intestinal, urinary, reproductive, and more. So make sure to include questions about that when inquiring about other symptoms. I typically start with questioning them about GI symptoms, such as heartburn, constipation, nausea, vomiting, anorexia, reflux, or diarrhea, to name a few. However, you want to think of these symptoms as which ones relate to the chief complaint. Some fit and some don't. So you have to ask a large variety of them. Asking broad questions initially allows you to understand what symptoms they have and what they don't. You begin to narrow down what may be the source of the pain based on their answers. In women, you need to inquire about associated gynecological symptoms, such as pelvic pain, vaginal discharge, pain with intercourse, known as dyspareunia, or dysmenorrhea, which is having a painful period. As mentioned previously, there are several organ systems in the abdomen. The patient may not realize the symptoms are associated with the pain. You must guide them by asking them directly. Bladder or kidney infections are just two of the many urological issues that may present as abdominal pain. So, you also need to ask about urologic symptoms for both men and women. Do they have flank pain, which is pain in the lower back or side? Pain with urination, known as dysuria? Incomplete micturition, where they are unable to completely void? Blood in their urine, known as hematuria? Or frequent urination?